Hello guys, how are you? I think so you would be fine and enjoying good health. Today I have selected a topic on thyroid disorder, which is hypothyroidism. So let's talk about hypothyroidism. Hypothyroidism happens when the thyroid gland does not make enough thyroid hormone. This condition also is called underactive thyroid. Hypothyroidism may not cause noticeable symptoms in its early stages. Now, hypothyroidism happens when the thyroid gland does not make enough thyroid hormone. This condition is also called as underactive thyroid, and over time, hypothyroidism that is not treated can lead to other health problems such as high cholesterol, hypercholesterolemia, and heart problems such as arrhythmias, atrial fibrillations, and blood tests are used to diagnose hypothyroidism. Treatment with thyroid hormone medicine usually simple, safe and effective once you and your healthcare provider find the right dosage for you. The symptoms of hypothyroidism depends on the severity of the condition. Problems tend to develop slowly, often over several years. At first, you may be barely notice the symptoms of hypothyroidism such as fatigue and weight gain, or you may think they are just part of getting older, but as your metabolism continues to slow, you may develop more obvious problems. Hypothyroidism symptoms may include tiredness, fatigue, more sensitivity to cold, constipation, dry skin, weight gain, puffy face, hoarse voices, coarse hairs and skin, muscle weakness, muscle aches, tenderness and stiffness, menstrual cycles that are heavier than usual or irregular, thinning hair, slowed heart rate, also called as bradycardia, less than 60 beat per minute, and the depression, memory problems. Hypothyroidism in infants. Anyone can get hypothyroidism, including infant. Most babies born without a thyroid gland or with a gland that does not work correctly do not have symptoms right away. But if hypothyroidism is not diagnosed and treated, symptoms start to appear. They may include feeding problems, poor growth, poor weight gain, stunting growth, yellowing of the skin and the whites of the eyes, a condition called jaundice, constipation, poor muscle tone, which is called hypotonia, dry skin, hoarse, crying, and large tongue, a soft swelling or bulge near the belly button, which is a condition which is called umbilical hernia. When hypothyroidism in infant is not treated, even mild cases can lead to severe physical and mental developmental problems. Hypothyroidism in children and teens. In general, children and teens with hypothyroidism have symptoms similar to those in adults, but they also may have poor growth that leads to short stature, delayed development of permanent teeth, delayed puberty, and poor mental development. When to see a doctor? See your healthcare provider if you are feeling tired for no reason or if you have other symptoms of hypothyroidism. If you are taking thyroid hormone medicine for hypothyroidism, follow your healthcare provider advice on how often you need medical appointments. At first, you may need regular appointment to make sure you are receiving the right dose of medicines. Over time, you may need checkups so that your healthcare provider can monitor your condition and medicine. Now, what are the causes of hypothyroidism? The thyroid is a small butterfly-shaped gland located at the base of the neck, just below the Adam's apple. The thyroid gland makes two main hormones, thyroxine T4 and triiodothyronine T3. These hormones affect every cell in the body and they support the rate at which the body uses fats and carbohydrates. They help control body temperature. They have an effect on the heart rate and they help control how much protein the body makes. Hypothyroidism happens when the thyroid gland does not make enough hormones. Conditions or problems that can lead to hypothyroidism include autoimmune disease. The most common cause of hypothyroidism is an autoimmune disease called Hashimoto's disease. Hashimoto's thyroiditis. Autoimmune diseases happens when the immune system makes antibodies that attack healthy tissues of thyroid gland. Sometimes that process involves the thyroid gland and affects its ability to make hormones. Then there might be thyroid surgery, which may be a cause of hypothyroidism. Surgery to remove all or part of the thyroid gland, lobectomy, can lower the gland's ability to make the thyroid hormones or stop it completely. Then is the radiation therapy. Radiation used to treat cancers of the head and neck can affect the thyroid gland and lead to hypothyroidism. Then thyroiditis, this is an inflammation of the thyroid gland. This can be due to an infection or it can result from an autoimmune disorder or another medical condition affecting the thyroid. Thyroiditis can trigger the thyroid to release all of its stored thyroid hormone at once. That causes a spike in thyroid activity, a condition called hyperthyroidism. Afterward, the thyroid becomes underactive, which is hypothyroid. Then there are a number of medicines that might lead to hypothyroidism. One such medicine is lithium, which is used to treat some psychiatric disorder. If you're taking medicines, ask your healthcare provider about its effects on the thyroid gland. Less often, hypothyroidism can be caused by problems present at birth. Some babies are born with a thyroid gland that does not work correctly, and others are born with no thyroid gland at all. In most cases, the reason the thyroid gland did not develop properly is not clear. But some children have an inherited form of a thyroid disorder. Often, infants born with hypothyroidism do not have noticeable symptoms at first. That's one reason why most states require newborn thyroid screening. Then there may be a pituitary disorder. A relatively rare cause of hypothyroidism is the failure of the pituitary gland in the brain to make enough thyroid-stimulating hormone TSH. This is usually because of a non-cancerous tumor of the pituitary gland. Then, in pregnancy, some people develop hypothyroidism during or after pregnancy. If hypothyroidism happens during pregnancy and is not treated, it raises the risk of pregnancy loss, premature delivery, and preeclampsia. Preeclampsia causes a significant rise in blood pressure during the last 3 months of pregnancy. And hypothyroidism can also seriously affect the developing fetus and brain development as well, and cause hypotonia and delayed reflexes. Not enough iodine might be one cause. The thyroid gland needs the mineral iodine to make thyroid hormone. Iodine is found mainly in seafood, seaweed, plants grown in iodine-rich soil, and iodized salt. Too little iodine can lead to hypothyroidism. Too much iodine can make hypothyroidism worse in people who already have the condition. In some parts of the world, it's common for people not to get enough iodine in their diets. The addition of iodine to table salt has almost eliminated this problem in the United States. What are the risk factors? Although anyone can develop hypothyroidism, you are at an increased risk if you are a woman, if you have a family history of thyroid disease, if you have an autoimmune disease such as type 1 diabetes or celiac disease, if you have received treatment for hyperthyroidism or received radiation to your neck or upper chest for any tumor in the neck area or upper chest, if you have had thyroid surgery. What are the complications of hypothyroidism? Hypothyroidism that is not treated can lead to other health problems including goiter. Hypothyroidism may cause the thyroid gland to become larger. This condition is called a goiter. A large goiter may cause problems with swallowing or breathing and heart problems. Hypothyroidism can lead to a higher risk of heart disease and heart failure. That's mainly because people with an underactive thyroid tends to develop high levels of low density lipoprotein LDL cholesterol, the bad cholesterol, and they also had developed peripheral neuropathy. Hypothyroidism that goes without treatment for a long time can damage the peripheral nerves. These are the nerves that carry information from brain and spinal cord to the rest of the body. Peripheral neuropathy may cause pain, numbness, and tingling in the arms and legs. Then infertility. Low levels of thyroid hormone can interfere with ovulation, which can limit the fertility. Some of the causes of hypothyroidism, such as autoimmune disorder, can harm fertility. Then there may be birth defects. Babies born to people with untreated thyroid disease may have a higher risk of birth defects compared with babies born to mothers who do not have thyroid disease. Infants with hypothyroidism present at birth that goes untreated are at risk of serious physical and mental developmental problems. Their developmental milestones are delayed, but if the condition is diagnosed within the first few months of life, the chances of typical development are excellent. The normal value within the first week of TSH In the children or neonate is up to 25 microgram per deciliter. TSH level in the adults may be up to the range of 5.2 micrograms millimole per liter. And myxedema coma, this real life threatening condition can happen when hypothyroidism goes without treatment for a long time, and myxedema coma may be triggered by sedatives, infections, or other stresses on the body. Its symptoms include intense cold, intolerance, and drowsiness, followed by an extreme lack of energy and then unconsciousness. Myxedema coma requires emergency, and this is a medical emergency and require medical treatment. What are the diagnosis of hypothyroidism and its treatment? The symptoms of hypothyroidism can be different from person to person, and they often look like symptoms of other health problems. Because of that, a diagnosis of hypothyroidism does not rely on symptoms alone. It's usually based on the results of blood tests. The first blood test typically done to diagnose hypothyroidism measures the level of thyroid-stimulating hormone TSH in the blood. If it's high, the test is done again along with a blood test for the thyroid hormone T4. If the result shows that the TSH is high and T4 is low, then the diagnosis is hypothyroidism. In some cases, the thyroid hormone T3 may be measured as well. If the second test shows that TSH but T4 and T3 are in the standard range, then the diagnosis is a condition called subclinical hypothyroidism. It usually does not cause any noticeable symptoms. TSH test also plays a role in managing hypothyroidism over time. They help your healthcare provider find and maintain the right dosage of medication for you. The results of these blood tests can be affected by some medicines or supplements. This includes biotin, a vitamin taken as a standard alone supplement or as a part of multivitamin. Before you have blood test done, tell your healthcare provider about any medicines or supplements you take. Now we come to the treatment. Treatment for hypothyroidism usually includes taking the thyroid hormone medicine levothyroxine, Levo-T, synthroid, L-troxin, others every day. This medicine is taken by mouth. It returns hormones levels to a healthy range, eliminating symptoms of hypothyroidism. You will likely start to feel better 1 or 2 weeks after you begin treatment. Treatment with levothyroxine likely will be lifelong because the dosage you need may change. Your healthcare provider may check your TSH level every year, and you may start it with 25 microgram and you can increase up to 50 micrograms, and then after 1 week or 2 weeks you can increase it up to 25 microgram, and you can take about 3 tablets of 50 microgram, almost 150 microgram per day, according to your symptoms and signs and disease severity. To find the right dosage of levothyroxine for you, your healthcare provider checks your levels of TSH about 6 to 8 weeks after you start taking the medicine. You may need another blood test to check TSH again 6 months later. Too much levothyroxine can cause side effects such as tiredness, increased appetite, sleep problems, shakiness, pounding of the heart, sometimes called the heart palpitations. Levothyroxine typically causes no side effects when used in the correct dose. If you change brands of the medicine, tell your healthcare provider that the dosage may need to change. If you have coronary artery disease or severe hypothyroidism, your healthcare provider may start treatment with a smaller amount of medicine and then slowly increase the dosage. This allows your heart to adjust to the rise in both your body's metabolism. Taking the levothyroxine correctly. Levothyroxine is best taken on an empty stomach at the same time every day. Ideally, you take the hormone in the morning before breakfast and then wait 30 to 60 minutes before you eat or take other medicines. If you take the medicine at bedtime, wait to take it until at least 4 hours after your last meal or snack. Do not skip doses or stop taking the medicines because you feel better. If you do, it's likely that the symptoms of hypothyroidism will slowly return. If you miss a dose of levothyroxine, take 2 pills the next day. Some medicines, supplements, and even some foods may affect your body's ability to absorb levothyroxine. Talk with your doctor. If you eat large amounts of soya products or if you typically eat a high fiber diet, also tell your provider if you take other medicines, especially iron supplements or multivitamins that contain iron, aluminum hydroxide, which is found in some antacids, and calcium supplements. Now there is another form which is the subclinical hypothyroidism. If you are diagnosed with subclinical hypothyroidism, talk about treatment with your healthcare provider. For a mild rise in the TSH, thyroid hormone medicine may not be useful. If your TSH level is higher but is still in the subclinical range, thyroid hormones may improve some symptoms. So another part is of alternative medicines. Most healthcare providers recommend taking the medicine levothyroxine to treat hypothyroidism, but an exact extract containing thyroid hormone derived from the thyroid gland of pigs is available. It is sometimes called desiccated thyroid extract. However, this treatment is not recommended because the amount of T4 and T3 in it may not be consistent from batch to batch. It is not safe for pregnant people to take desiccated thyroid extract because it can harm a fetus's development. So, preparing for your appointment, you will likely start by seeing your primary healthcare provider, or you may be referred to a specialist endocrinologist in hormone disorders. And infants with hypothyroidism need to see a pediatric endocrinologist right away. Children or teens can start with their primary healthcare provider, but they need to see a pediatric endocrinologist if there are any questions about levothyroxine or about the correct dosage of the medicine. Here's information to help you get ready for your appointment and know what to expect from your healthcare provider. What you can do: be aware of any pre-appointment restrictions. When you make the appointment, ask if there's anything you need to do before you arrive. Write down any symptoms you are experiencing, including any that may seem unrelated to the reason you scheduled the appointment. Write down key personal information, including any major stresses or recent life changes. Make a list of all medicines, vitamins, or supplements you are taking, especially biotin. Take a family member or friend along with you if possible. Someone who goes with you may remember something that you missed or forgot. Write down questions to ask your healthcare provider. Having a list of questions helps you make the most of your time with your healthcare provider. For hypothyroidism, some basic questions to ask include: what the most likely cause of my symptom? What the test do I need? Is my condition likely temporary or long lasting? What treatments are available and which do you recommend? I have other health conditions. How can I best manage them together? Are there restrictions I need to follow? Should I see a specialist? Is there a generic alternative to the medicine you are prescribing? Are there brochures or other printed material I can take with me? What website do you recommend me for searching for hypothyroidism? What to expect from your doctor? Your healthcare provider is likely to ask you a number of questions, including: when did you begin experiencing symptoms? Have your symptoms been continuous or occasional? How severe are your symptoms? Or how milder are your symptoms? What, if anything, seems to improve your symptoms? What, if anything, makes your symptoms worse or deteriorated? Do you have a family history of thyroid disease? So these are the questions that your doctor might be asking from you. So it was all about hypothyroidism, and I have discussed in this topic in greater detail, so it will be helpful for the audience. And if you have liked my video, then kindly don't forget to subscribe my channel and share this video with other individuals as well who are suffering from thyroid disorder, especially hypothyroidism. So thank you for listening and watching my video, and have a wonderful nice day. Thank you very much.